How would you promote equality, diversity, and inclusivity within the department? Can you give an example of where you identified inequality in patient care and what did you do about it? How would you make sure that all members of your team feel valued and able to contribute? These are the kind of questions that often come up in a consultant interview around diversity, equality, and inclusivity, often shortened to DEI. They sound like vague questions, and honestly, some of the answers I've come across are also quite vague. Most answers tend to be quite generic. This often involves saying that you'll treat everyone fairly, respect everybody, and be supportive of all colleagues. Now, that's all absolutely true, but it doesn't really tell the panel very much about you. What I think makes a stronger answer is when you're able to bring these to life with examples from your own experience. Before we get into that, it's just important to understand where this question is coming from. This is rooted in the 2010 Equality Act. So the Equality Act produced what's known as the 9 protected characteristics, and these include things like age, sex, disability, sexual orientation, race, and a number of other characteristics, which you're not expected to recite, but you're just expected to understand what these things mean. And what the panel is really trying to understand is whether you appreciate the principles behind them. Do you understand that people should not be disadvantaged simply because they belong to one of these particular groups? Do you understand the barriers that some patients or staff may face? And what would you actually do about it? So why do these questions actually get asked? Well, I think there are 3 main reasons, in my opinion. The first one is that these often are a requirement by HR, and there's an obligation to ask you around equality, diversity, and inclusivity. And therefore, these questions find their way into at least one person's question selection. The second is that the panel genuinely wants to understand your attitude towards these things, and as a consultant you will be a senior leader within the organization, and they just want to make sure that you've got the right attitude towards equality, diversity, and inclusivity. So your views on these things matter. And the third reason, perhaps most important from an interview perspective, is the fact that this question allows you as the candidate to talk about yourself, express your experiences, and just open yourself up a little bit to the panel. So think about it. You can use this to your advantage because every other candidate who's applied for the same job has very similar qualifications and experiences to you. So you could actually use this question to stand yourself apart a little bit. So in this episode then, I'm going to give you some conversation points and some examples that you can build upon. So it's not to memorize the script, but hopefully after the end of this episode, you will know what to talk about and try and use your own experiences to come up with a credible answer that scores you decent points in an interview. Now, one of the first concepts that comes to mind is the concept of unconscious bias. Now, I think we all understand what unconscious bias is, and it's an interesting concept because it forces us to examine our own thinking. Most of us like to think that we're objective and that our decisions are all based on facts and clinical issues. But now that's certainly true because as a human being, I think no one is being consciously biased, and it's in the name itself. Because it's unconscious, we often don't even realize that we're being biased. One of the most famous examples comes from a study done in America looking at the use of thrombolysis. Obviously, this is back in the day when thrombolysis was the first-line treatment for acute MI. In this experiment, they presented to doctors clinical scenarios involving, on one hand, white Americans and on the other hand, black Americans. Now, when the diagnosis was absolutely obvious and the indication for thrombolysis was quite clear, there wasn't much of a difference in who got what. It was pretty equal between both the groups. Now, the interesting finding came to light when there was a bit of uncertainty. When the diagnosis was less clear and there was room for interpretation, this is where white American patients were more likely to receive thrombolysis than black American patients. Now, the key point here is that no one was trying to actively discriminate against any group of people, but it's the fact that uncertainty can create room for assumptions and shortcuts. And that's where unconscious bias comes in. Now, before we think too self righteously and think that this only happens to other people, it's worth reflecting on our own practice. Take something like an intravenous drug user. Now, the moment you hear those words, you make some assumptions about that person. A lot of these assumptions, let me say, they're not just assumptions, they're probably learned things from your experience. But the moment you hear the word intravenous drug user, you start thinking about blood-borne viruses, you start thinking about endocarditis, you think about poor engagement with healthcare, poor hygiene, and all the other circumstances that traditionally surround intravenous drug users. Now, the problem is that there is a very, very fine line between using your clinical experience to inform clinical judgment and assumptions that may influence how you're going to treat this patient. Now, because the question that we always ask ourselves, or we should ask ourselves, is would I have approached this patient differently if they weren't an intravenous drug user? What if they were a teacher or an accountant? Would my management of the patient have been any different? Would I have offered more options? Now, these are uncomfortable questions, but probably the right questions to ask. And that's why I think that one of the strongest answers you can give in an interview is not to pretend that unconscious bias doesn't exist. And you could, in fact, use this particular example and build on it. Now, I'm sure you'll have more stories to tell, and you will have those stories because, as I've said many times before, it's important that you keep a log of these stories. Just write them down anywhere you want to, on Google Docs or Microsoft Word, in any order that they occur to you, because now you have ChatGPT. You can put all of that into ChatGPT and ask it to organize your stories by theme, and these stories are going to be immensely useful to you in any upcoming interviews. Anyway, I digress there. Coming back to the topic of unconscious bias. So acknowledge that it probably affects all of us, and the challenge isn't eliminating it completely. You can't. It's the fact that you've got to recognize it as an organization, the fact that it exists, and building systems that reduce its impact. Now, awareness of unconscious bias is useful, but this is where we move on to the next point in the DEI question is, what can you do about it? Can you do anything about it? And the answer is yes, and this can be another talking point. So the second thing I want to talk about in this is standardization. So self-awareness, yes, but that's not enough to take away the unconscious bias. Most organizations do the awareness part by employing this thing called mandatory training, which we've all been through. And it often involves clicking through a set of slides or sitting through a video or even someone speaking to you in a classroom. You get a certificate at the end of it, and you're certified as competent, the fact that you understood what unconscious bias is. But does it functionally change behavior? I'm not convinced that it does. And I'm sure you will agree with me that something like an hour-long classroom session just doesn't completely eliminate something like unconscious bias. And this is where a lot of healthcare can learn a lot from things like human factors. Because where human factors are involved, or rather where human beings are involved, decision-making involves a bit of variation. And as we've seen from the thrombolysis example, when there's variation, there's going to be a bit of unconscious bias that's going to creep in. So the answer to that has been standardization. And you could cite the example of the interview itself, where, many years ago, consultant was appointed simply on the basis of whether people knew them, they were well liked, and whether you got along with the department. It used to be something like, you get along well with them, you shake hands, the department thinks you're going to be a good fit, and you get appointed. Now, fortunately, we've moved on from those times. We've got standardized interview panels. We've got interview panels that have now got to ask standardized questions, including the DEI question, for example. The scoring systems are standardized. So whether you partially met the criteria or partially answered the question, you fully answered the question, you excelled in the question, and you got multiple assessors. It's not just 2 or 3 people in a panel. You often have interview panels for up to 8, 9, 10 people who are all examining you. And in the end, it's the sum total of all the scores. So that's been a system of getting through or overcoming unconscious bias when appointing someone. And the same principles can apply throughout healthcare when it comes to things like clinical pathways, protocols, guidelines, checklists, SOPs. All of these things exist partly because there is variation in practice and they are designed to reduce the variation in practice. So if you were answering an interview question on this particular aspect, you could always talk about something you've done in the past in this area. So rather than saying that, I trust everybody fairly and I treat everyone fairly, you could say that you've been involved in building systems that standardized care for a particular condition, and I've tried reducing variation and standardize the care pathway. Maybe you worked on a guideline, or maybe you've involved in a recruitment process. I mean, some of you will have been involved with recruitment across your deaneries or within the trust that you work in. Referrals being prioritized in a standard way, that's another one. So these are all examples of trying to make the system fairer rather than relying purely on individual judgment. And I think that will come across as a much more credible answer than just, making a generic statement about unconscious bias and inclusivity and diversity. Now, the other part in all of this is inclusivity, which is really about whether people feel able to contribute, to speak up and be heard. It goes beyond sort of the protected characteristics, and it's about ensuring that everybody can feel heard, whether people feel that they belong to the organization, and most importantly in healthcare, whether they have the ability to speak up when things go wrong. Now, if you've listened to anything around patient safety over the last decade, you'll know that speaking up has been a recurring theme with a lot of incidents that have gone wrong. Things like wrong side surgery, medication errors, near misses, equipment problems, and time, whenever these incidents were involved, somebody often saw that something was not quite right. And the problem wasn't knowledge, the problem was their inability to speak up. And this is where inclusivity comes in, because inclusive teams are not necessarily teams where everyone agrees. It's the team where there is that environment where people feel safe enough to speak up and disagree. When interview panels ask questions like this, how will you ensure that all members of your team feel valued and contribute? What they're trying to get at, I think, is for you to talk about the psychological safety and how you create that in your teams. So would a medical student feel comfortable asking a question? Would a resident doctor feel comfortable challenging a consultant decision? And would an ODP, for example, be comfortable pointing out an obvious mistake? Now, the good thing is that you don't have to be a medical director to influence this. You don't have to change the whole organization. All you need to do here is to think about the environment you work in and see what you can do about bringing about that change. So you could have many examples from your past where you were inclusive, and perhaps there was a time when you helped somebody speak up. Perhaps there was a junior colleague who was struggling and you helped them raise a concern, or perhaps you were at the receiving end of not being able to speak up. You felt intimidated or you were worried about the consequences, and you could describe that situation even. And as long as the example highlights the core concepts of what inclusivity is, I think, once again, it's far better than just generating a generic answer in the interview. So hopefully this has helped you think of some talking points which you can narrate out in interviews. So think of examples. Talk about unconscious bias, because I think that is the whole basis of the fact that these unconscious biases create the inequality, and then talk about inclusivity, which once again, if you start writing down your examples in a notebook, on Google Docs, MS Word, anywhere, the advantage of digital is you'd probably be able to use ChatGPT. Write them down because they will be immensely useful to you when it comes to preparing for any interview. All the best, and I will see you next time.